Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. First patient's come through with very deep impacted earwax, pushed right up against the eardrum. Had felt a little bit of discomfort in there. Used a Q-tip then to try and remove the wax, but unfortunately pushed it further in. Then went for some irrigation, so some syringing, where they try and flush the ear with water. Unfortunately, that was unsuccessful and pushed the wax even further. So we've got some very deep impacted wax here. What we're using is the standard size Zollner tube. So we're going to try and stay away from this wax and pull it towards the suction machine. He's been feeling that the unsuccessful irrigation was done probably about a week ago, and he'd been blocked up for about a fortnight before that, so really at the end of his tether, bless him, when he came through to see us. So what we're doing now is using that standard size Zollner tube to try and loosen this wax much further in. You can see just slowly pulling this top section away here, gently trying to break some of this away. The wax itself has become quite sticky and bound together really well, and it's very well lodged. You imagine that's been forced in with a Q-tip, and the irrigation has actually impacted it down there as well. So I've introduced a little bit of olive oil. I wanted to keep this particular section of video in here. The screen goes really blurry, but I talk to you sometimes about this, using the olive oil, the benefit of the oil compared to the downside of it blurring the camera lens. So you can see as we're going in all the time at the moment, we're just getting that blurring effect to the camera there, because the oil sticks to the outer hairs, even though we use a spray rather than a drop, which gets it in a bit further. We're holding on to the bottom, and it's loosening away from the canal wall, just breaking that surface layer away. The olive oil does make a big difference, especially with deep-seated and sticky wax like this is. So we're just holding the suction just there, trying to build the suction a little bit, but it's not really budging. So I'm just going to work further out from the canal now, grab this section that's onto the left-hand side canal wall, try and take that away, because that may well be anchoring it in place here. There we are, pulling into the center, trying to just detach it from all those canal walls so we stand a better chance of getting this out. We're going to aim for that bottom section there, hold the suction tube on that section. That's going to allow the suction to really grip into that wax. And I'm going to use the suction force. I don't want to press into it. I'm going to use the suction force to lift very gently and pull at the same time. Here it comes. Keep watching that bottom section. There we are. You can see it detach from that last little piece and come away. So this was the piece that was jammed right up against the eardrum. You can see the oil left on the eardrum, the patches there, and the dullness of the eardrum, which has been really pressing against that. So really uncomfortable for this patient as well. So we can see what removed. This is all from one ear canal, so 1.5 centimeters there of wax. You hear the dog bark in the background, and just over 1/2 inch of wax there as well. So you can see how dark that is, very old type wax. So this is the second patient in our compilation. This lady's come through with wax blocking both ear canals here. So we can see we've got that same dark, sticky consistency of wax, so really stuck to the canal walls. Got a grip on that front section there with the Zollner tube, just taking that away. There we are, and that allows us to get behind there and grab the next section of wax. There we go. You can see that slowly starting to peel away there. There we go. Just rocking it gently. What we're trying to do is roll this wax down just to get a good grip. Remember what I said before, if you're trying to hold onto an angular piece at the front, you don't get the good grip, but if you can roll the wax, you get that smoother section that's been sitting against the canal wall. Allows you to get a really good grip on that then. Slowly working this down. There we are, just taking these tiny little chunks away a minute, but breaking this wax down, just teasing it all apart. That really sticky nature there again, so we're just holding on to that top section, trying to let the suction build, get a good grip. can see it's just really stuck in there at the moment, but it is coming away, so we're resisting the urge to put any olive oil in here at the moment. There we are. You can see we've broken that bottom section away there. Now it's starting to pull away from the sides as well. We've detached it there from that left hand canal wall. There is another little piece of wax just stuck there to that left hand side, which is just stopping this from moving. So I'm trying to budge it underneath there. I'm not taking that piece away on the left hand side just yet, because if I try and lift it and peel it away from the canal wall, it's going to shove this main section back down in. So I've got to kind of work around it a little bit. Otherwise, we're going to push this into a very deep part of the ear canal. So we've got a good suction grip there. You can see we're getting that wiggling, twisting motion there, just freeing it up from the canal walls, guiding it out to the canal. There we go, on its way. And out it pops. You can see that dry nature to the wax, little tiny hairs in there as well. So we'll look past that now. You can see we've got another section that's been brought out with it. So drop that into the bowl of the canal. Let's carry on and get the next piece. There we are. Now we can see this deeper section of wax now. So we're going to have to lift this. Be careful because it's on that sensitive ridge, that little ridge above the valley just in front of the eardrum. You can see we've managed to detach it from the canal wall there, but it's left this angular shape to the front. So a very thin wedge of wax to try and get a good grip on. Managed to get a grip with the suction tube there. As all the tubes come away, that's that flat section you can see there. If we look in behind it now, we can see the eardrum looking lovely and clear. There's just a little tiny bit of dry wax there to the bottom right corner. Let's just take that away just for the sake of completeness. Get rid of that. A little tiny bit of dry skin flicking up. Smooth that down. There we are. So you can see the eardrum. Not a very pronounced light reflex there, so a little bit of middle ear fluid going on in that ear as well. This is the second ear, so patient not really having too much difficulty with this side. Based on how dry and sticky the last section of wax is, we've bit the bullet and just gone straight in with some olive oil here. We can get a good grip on that bottom section, and you'll see as we lift, because we've got that bit of olive oil in there as well, that whole front section comes away from the main block of wax. There we go. And we'll take a look behind that. We come to the next dry piece of wax there. Managing to get that good grip. There has been a couple little gaps around this wax allowing the sound through. Just holding the suction tube and they're trying to get a good grip on this. You can see it's just peeling that front section away. So we're going to go in with the Jobson horn now. We've got it to the entrance of the canal. Really easy to get the Jobson horn behind. So we're just going to push that front end down, giving us a little gap to work the Jobson horn in. And slowly roll this forwards. There we are. Get a little bit further in now. Try and get behind that rear section. Aiming to try and get out in one piece if we possibly can. There we are. Out it comes. You can see the little hairs there as we back away from the block of wax there. We pass through those tiny little cilia. There we are. There's the wax coming away there nicely. It did look like it sheared off. Yep, there it is. So there's the second half of that wax now. So we'll just go above that, bring that forwards. There we are. And the same thing, just slowly work the camera back through those little hairs. You can see that block that's come away there looking sort of nice and healthy. There we are. Eardrum looking good. Slightly better light reflex on that side, so all looking nice and healthy in there. You can see that sort of reddy brown, that chestnutty color, which is this dry, sticky type wax. See, quite a bit came out there. So just over 4 centimeters, inch, and oh my goodness me. Okay, I'm going to call that 9/16, if that's a measurement. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.